The United States marks a grim milestone. It now has the highest number of coronavirus cases in the world, ahead of China and Italy. Hello, I'm Anand Naidu. This is The Heat. The United States is now the epicenter of the coronavirus outbreak, with over 82,000 people infected and more than 1,150 deaths. Americans are also reeling from a hit to the economy. A record 3.3 million people filed for unemployment benefits last week. The government is expected to vote on legislation providing an economic lifeline for struggling businesses and households. We begin our coverage with CGTN's Nathan King live at the White House. And Nathan, another grim day across the globe, but a little bit of hope here in the United States with passage of that stimulus bill, which I guess will bring some relief in the country.
Yeah, no, the House of Representatives have still got to pass it, but yeah, it looks like a done deal. Over 2 trillion, about 2.2 trillion, although it could go even higher, of stimulus, not just for American families, but American corporations. And, you know, even, you know how divided this city is between Democrats and Republicans. It's got very nasty over the last few years. They did come together, but there are some real differences. The fact the Senate led this, which is Republican controlled, you saw a lot of sort of corporate giveaways, and there are still some big questions among Democrats, for example, on the cruise industry, giving tax breaks for real estate, all that sort of stuff. But the Democrats also tried to put some of their stuff in there, and so it's going to pass, but it's going to be a bitter pill to swallow for nearly everyone. But the main things I think we're really going to look at is the direct payments to American taxpayers up to $75,000 per person, phases out around $99,000. You know, a family of 4 could get $3,000 or $4,000. That's going to be very helpful indeed. Unemployment insurance is being extended. Healthcare for all coronavirus virus testing and treatment. There is a lot in here that's actually going to help the average American as well. The question is, given the severity of the shutdown here in the US, will there be more? Because will this be enough? Because if this does go on for months and not weeks, then you could see Congress having to come back.
Also, Nathan, a grim jobs report that those figures we got today, stunning figures, more than 3 million people filing for unemployment benefits. Is that the worst of it, or are we going to see this sort of unemployment trend persist for a while?
Yeah, nearly 3.3 million in 1 week, not 1 month. The one before that highest was about 675,000. So you can just see this is off the charts. I mean, this is not a financial crisis, this is a health crisis, and the shutdown is leading to this. But it just shows how quickly people went from job security to no job within a week. Now, it's going to get worse because, you know, anecdotally and also reports that we've seen is the unemployment enrollment centres were completely overwhelmed, website or in person, and more people are filing by the day. What we've really got to look for is the monthly jobs report, which comes out the first week of April. That will be very bad. But the White House here have basically said, look, we knew the numbers were going to be bad, and sort of ignore them because everyone's in this together, everyone's losing their jobs at the same time, and we are providing the assurance that essentially your jobs won't go away. Essentially, America's being furloughed in their messaging, but it is deeply worrying because, as you know, the US economy had been humming along. We had record low unemployment, and then a record weekly unemployment number just is shocking most Americans.
And Nathan, looking at the global effort to counter the coronavirus, there's a G20 summit, but even that had to be virtual, of course.
Yes.
Any concrete resolutions made at that meeting?
Concrete is pushing it, but it is a sign of multilateralism. As you know, the G7 summit couldn't agree on a statement, largely because of US wanting the phrase Wuhan virus in there. All the other countries didn't want that in there. We've seen the UN Security Council deadlock. So this is also a grouping that has a lot of Asian members in it, as opposed to the G7, which just has Japan. So China's in it, South Korea, and others who also have been at the front of the pandemic and confronting it. So it's a good group. Let me just tell you what their statement read out. They basically said, look, obviously protect lives first, safeguard people's jobs and incomes, restore confidence and preserve financial stability, and revive growth and recover stronger. That's going to be very interesting to see how China and the US try and, if they do work together on that, like they did in the financial crisis. Minimize disruption to trade and global supply chains. President Xi actually said, let's get rid of the tariffs, considering we're dealing with this. So it's going to be very, very interesting on that. And coordinate on public health and financial measures. Although no talk about all coming together for some sort of vaccine, they also had some strong support for the World Health Organization in there as well.
Thanks, Nathan. Nathan King there for us at the White House. Well, for more on the pandemic's impact on the United States and Europe, we're joined now by Joseph Williams, right here in Washington, D.C. He's senior news editor at U.S. News and World Report. From Beijing, Einar Tangen is a political and economic affairs commentator. Harry Hull is an epidemiologist and infectious diseases expert. He joins us from Reno, Nevada. And from Spain, Lorenzo D'Agostino is a freelance journalist based in Barcelona. Welcome to all of you to the show. Joseph, let me start with you. We just talked about that very grim milestone that just passed here in the United States. More than 82,000 cases of coronavirus right now, and the death toll going to over 1,000. And when we look across the country, entire cities, towns have been shut down, people practicing social distancing, people taking precautions, and yet that number keeps going up. What does that tell you about the measures that are being taken right now?
Well, it says two things. Number one is that we're not even at the end of the beginning. Quite frankly, this virus just got to the shore not that long ago. We're short of testing kits. We don't know even seriously how many people would test positive if we were able to test everyone in the United States. So there's a lot of unknowns here. We're not quite sure exactly at what stage of this pandemic we're at. The second thing it tells us is that extreme measures are being taken to try to either contain the virus, i.e. social distancing that everybody's been talking about, hollowing out streets. Washington, it's been unlike anything I've ever seen. It's a virtual ghost town. Very few people on the streets. People are taking this seriously for the most part. The third thing it tells us, however, is that there are areas in the United States that are bracing for the worst, most notably New York City, been hit very, very hard. Hospitals being set up in convention centers, a warlike footing, almost literally in the medical response here. There was the governor of Maryland, Larry Hogan, was touring the Baltimore Convention Center alongside some fatigued National Guard troops. The convention center had been transferred into a makeshift field hospital. We're going to see more of that. It's going to get worse before it gets better, and a lot of these images are going to be very shocking to many Americans that will occur here on these shores.
All right, let's bring in Harry Hull from Reno, Nevada. And Harry, we're still seeing reports of hospitals being overrun, shortages of vital equipment like ventilators, respirators, and we see these shocking pictures of nurses at a New York hospital using plastic trash bags to protect themselves because of a shortage of equipment. What do you make of the federal and state response so far?
Well, I think that the federal response has been far too slow. This pandemic was not taken seriously at the beginning, and there's a lot more that could have been done to mobilize in advance. The situation that we have now is what we have now, but I would agree that we're just at the beginning phases of this outbreak. New York is contributing half the cases right now, but I was listening to TV just before I went on, and we're hearing of dramatic increases in Chicago and Detroit. We're also hearing that there are dramatic increases down in Louisiana, in addition to what we've seen out on the West Coast. So I think that we can see that the situation is going to get worse. And I would agree it's going to be shocking to the American people when we get to the phase that Italy is in, where they're having to ration healthcare, decide who gets a respirator, who does not, because there's not enough respirators. And when we have people dying in the hallways of hospitals because there aren't enough beds.
Harry, when you say that this is spreading to places like Detroit and to Chicago as well, does that mean people are actually carrying this to the new cities? Would that, would that at some stage, would the government have to completely shut down travel from one place to another?
Well, you could shut down travel, but I think that that's very difficult here in this country. And I think that we also have to keep in mind that the cases that we are being diagnosed today were transmitted several weeks ago. For example, in New Orleans, they didn't take it seriously, and they went ahead with Mardi Gras. And 2 weeks later, they started seeing cases. And now it's really taking off. So I don't think that we can totally shut down travel. I think that we can learn from the Chinese model, for example, but I don't think that we can exert the degree of social control here in the United States that was exerted in China. And even with that level of social control, China is now getting to the point where they have very few cases. I mean, early this week they said they had none, now they're having a couple more. But it's taken them 3 months to bring the situation under control. So I think that we can expect the same, at least the same thing to happen here in the United States, unless there's some kind of dramatic effect with the arrival of warm weather. But even then, it will come back in the fall.
That's right. In the Chinese case, these are cases coming from abroad into the country right now. Let me bring in Lorenzo. Lorenzo, you are in Barcelona in Spain, which is also in the new language that we are learning, become a hotspot. The number of deaths there has surpassed China. There are also reports of an ice rink in Barcelona being converted into a morgue. What is the situation in Spain right now, and to what extent is the healthcare system there being overwhelmed?
The situation in Spain is dire, indeed. Spain has shown some of the steepest curve in this global pandemic. And today only, there were 655 people who died. The death toll has surpassed 4,000. Spain is now the second most hit country by coronavirus in terms of deaths. And we are already seeing hospitals in Madrid starting to be overwhelmed. With patients. Doctors are struggling. We are seeing scenes that we've already seen in Italy of doctors building for themselves makeshift face masks because there is not enough for everybody. There have been very sad reports of care houses for elderly people where the Spanish army has intervened to sanitize them, and it has found dead people lying there for over 24 hours, living with people who are still alive. That is because even the funerary services in Madrid, which is the epicenter of the crisis in Spain, were overwhelmed. So funerary centers basically couldn't provide their services for up to 24 hours after the death of the patients. We are starting to see scenes that are unfortunately very similar to what we have seen in Milan, which is probably the worst hit area in the world right now.
Einar Tangen, we see this dire situation around the world, but it seems that politics is not very far behind. We just heard the United States President Trump, continue to use rather very derogatory, ugly terms with reference to China and the coronavirus. This is what he said a short while ago. Let's listen to this.
I talk about the Chinese virus, and I mean it. That's where it came from. If you look at Ebola, if you look at all of Lyme, right, Lyme, Connecticut, you look at all these different horrible diseases, they seem to come with the name, with the location. And this was the Chinese virus. But I don't have to say it if they feel so strongly about it.
And Anna, we've also had other officials in the Trump administration use this kind of language. What's behind it?
Well, it's simply a way of scapegoating China for the lack of preparation that his administration, they didn't take this seriously. It's grown out of control. There is no coordinated response. And therefore, Donald Trump, this is an election year, is concentrating on using $2 trillion as a kind of election piggy bank to shore up his popularity, and then also saying that his lack of preparation was the fault of China. There's not much else you can say.
Joseph, we also had shocking news this morning. Our reporter Nathan King talked about it a moment ago, and that's jobless claims up to 3.3 million. What does this tell us about the economic hit that the country is taking right now, and what is up ahead?
The hit has been tremendous. I heard one commentator refer to it in a metaphor as the U.S. economy was humming along, and then all of a sudden the virus forced us to slam the brakes. And the brake slamming has led to this economic cushion, if you will, of the stimulus and the $2 trillion, like 1/10 of the United States economy, in being ladled out to people who are going to be hurting and who are going to be in need. But the overriding fact here is that The jobless claims are shocking, fivefold what we've seen even in the worst of the Great Recession a couple of years back. But again, just like the virus, this is not going to be the worst of it. There's a sonic boom effect that's going to happen where the jobless claims from this week are actually from earlier in the month. And as the virus goes along longer and as people are more forced to more contain themselves and socially isolate, more businesses are going to go under, more people are going to lose their jobs, and the boom from that sonic boom effect is really going to hit hard. I would not be surprised to see jobless rates double by the end of the third quarter, second quarter, and I would not be surprised to see Congress have to go back to the piggy bank, if you will, and order up some more money for struggling Americans, because it is going to be very painful and a lot of people are going to feel it.
Yeah, that's a point there. On the point of the stimulus package, Joseph, that is in Congress, this will give payments to individuals, to families, to small businesses, but these are one-off payments, aren't they?
They are, and that is the problem. We've heard experts talk about this. This virus is not going to go away by Easter. It's not going to go away by even May, some are predicting, or even summer. And even if it does, it will rebound. So we are not out of the woods yet by any stretch. We are barely at the end of the beginning. And that is going to force more people to look for more ways to pay the bills and keep their kith and kin together. So that also will mean that Congress is going to have to go back and help these people to keep the economy from falling completely off the cliff. This is just a shock absorber. It is not going to prevent a long fall that a lot of people are predicting as this virus goes on. And it's kind of ironic in that the money that Congress is giving out to every American, that is intended to help people go spend. But you can't go spend if you can't go anywhere. And that is going to be the cyclical effect of this particular virus. And I think Jerome Powell was it today, said that the recovery is going to be dictated by the virus. The virus has the timeline. We cannot move until this pandemic is over.
Harry Hull, there was something else that President Trump talked about again today. He's holding out the hope that, or he believes rather, that the worst is over, that we've turned the corner and some people can now start going back to work. And there's a plan underfoot right now, and where he's talking about, the risky counties, less risky counties, medium counties with a medium risk, where people can go back to work. And there were reports that people will be encouraged to go back to work in these areas. But what will that do? Will that stop the virus, or could it make it worse?
I think it's going to make it worse. And I think the idea of really being able to effectively categorize counties is fanciful. I'm not sure how they're going to collect the data to do that. We don't have the testing capacity. Certainly you can categorize counties as higher risk than, based on their population density. I mean, Chicago is going to be at higher risk than a county out in Kansas that only has 200 people living remotely on farms, and they only come to town once a week. So I think that this is totally unrealistic. And I do have to say that when I look at the coronavirus task force, the president is clearly not getting the best advice. CDC appears to be totally sidelined. These are the best epidemiologists in the world, the people who sounded the alarm, who've handled so many outbreaks, were able to stop SARS. They are not on the task force anymore. The president is clearly not getting the best advice that he can in terms of controlling the outbreak. And I'm worried that we have some fanciful thinking here that's not based in reality.
Do you think, Harry, that he's getting good advice, but he's just not listening? He's not taking it to heart. He's got other priorities.
Yes, absolutely.
All right, Lorenzo, let's get back to you. We're getting these reports of elderly Spaniards being abandoned in nursing homes. There have been some very tragic stories that we've been reading in the newspapers here. They've been abandoned because of a shortage, like in other parts of the world, shortage of manpower, shortage of equipment. Do you know anything about that?
Yes. Unfortunately, the health system in Europe are proving to be weaker than most people here expected. Here in Europe, we are very confident that whenever we fall sick, there's going to be a doctor for us. So this is really coming as a big shock to the European public. to see the fact that many times in hospital, they are starting to have to choose whether to give you a respirator or not on the basis of your survival chances. We're seeing that in Italy, we're seeing that in Spain. It's not the case that we're seeing the worst, the sort of worst cases in regions such as the region of Milan and the region of Madrid, where local governments have severely cut the healthcare budget over recent years. So doctors are under massive stress. In care houses, the case is the same. And it really seems like political leaders couldn't see this coming, really. It came as a massive shock again, both to the political leaders and to the European public.
Einar, Tangen, as far as the pandemic itself is concerned in China, what is the situation now? You know, as I think it was Harry that told us earlier on, there are no new infections, but there are still some infections coming in from abroad. And what is the restrictions that were put in place in Hubei province as well as in Wuhan? Have those now been completely lifted?
No, not completely. They're bringing things out slowly. In fact, on April 8th, they're anticipating that the city of Wuhan itself the restrictions will be lifted. But when you say restrictions lifted, that means just in terms of travel. There still will be people checking your temperature when you go into restaurants or anywhere else. In Beijing, for example, most of the restaurants are still not open. They're just opening slowly. They're limiting the capacity. If you could fit in maybe 50 people, they'll allow in maybe 15. So it's not, quote, going back to normal, but they are lifting the more severe restrictions. But I mean, China has demonstrated one thing, and I think this entire panel would agree, that what we have here is a situation that's growing exponentially. We're thinking that we're in the worst of it now, and that is not the truth. The truth is that the U.S. has dropped the ball in this, that for some reason, Donald Trump fails to understand that until you deal with the health issue, the actual virus itself, you cannot calculate what the economic cost is going to be. And this is tragic. It's not only here, but it was also very clear at the G20 that there was not any kind of leadership being put forward by the U.S. Saying that the meetings with leaders was great does not make a plan.
Joseph, of course, this is a global challenge which requires a global solution, but we're still seeing United States leaders play politics with this, with some of the comments they've made. I want to play something to you which was said by the U.S. Secretary of State, Mike Pompeo. Let's listen to this.
This isn't a time for blame. This is a time to solve this global problem. We're focused on that today. It's where the G7 members spent all of their time. But every one of the nations that was at that meeting this morning was deeply aware of the disinformation campaign that the Chinese Communist Party is engaged in to try and deflect from what has really taken place here.
And Joseph, we did get a response from China. This was the Chinese Foreign Ministry spokesman. Let's listen to this.
The epidemic is currently spreading rampantly around the world, and the situation in the US is getting worse. At the moment, if this politician still repeatedly provokes political disputes and undermines international cooperation in fighting the virus, rather than being dedicated to his country's domestic epidemic prevention and control and creating a favorable atmosphere for international cooperation, then he doesn't seem to have any morals.
So, Joseph, we've just had some of the biggest countries in the world, the G20 summit, where these countries should be coming together to find common solutions to this challenge. But we see the sniping going on. In fact, there's also another fight going on between Saudi Arabia and Russia, and that's on the oil price. I mean, are these leaders going to set aside their differences?
One would hope so, but the evidence clearly points to the contrary. I mean, it's really fascinating to hear Mike Pompeo say that the time for blaming is not here, and yet then quickly pivot and point the finger at China, which is to me just kind of mind-boggling that we have a Secretary of State who is so undiplomatic at a time that requires such diplomacy. The other thing that's really striking here is the fact that the United States typically is the global leader. Typically, the United States is the one that tries to work out differences between countries, tries to get everybody on the same page, tries to get people to cooperate. But I would argue that we're seeing the very clear residue of isolationism here. The United States, like it or not, is the leader on the global stage. The United States, whether they like it or not, tends to be a role model for other countries. A lot of people would dispute that, but certainly behavior a lot of times is modeled on what the U.S. does. As the biggest kid in the playground, we tend to exert a lot of influence. Now that that influence has been withdrawn under President Trump, you see chaos. One could even argue that the reason why the Chinese government did not act so decisively is because they felt like this is an era where you can try to obfuscate, where you can try to get rid of and shade the truth and maybe hide things, but viruses always will out. And I think that's the big takeaway here, is that no matter who says what about who said what when, the virus is going to continue to kill people. The virus is going to continue to damage global economy, not just the United States economy. And the virus will ultimately have the last word on who is handling it properly and who isn't.
Harry Hull, very quickly, I've only got less than a minute left. What are your thoughts on the risk of there being a second wave of infections, which could again hit countries like China and South Korea?
Well, I think that there will be continued circulation of this virus. People talk about it disappearing in the summer, but remember that it's winter then, and when it's summer in the northern hemisphere, it's winter in the southern hemisphere. So I think that we'll see this coming back, and this model that is being so widely touted talks about repeated periods of social distancing being necessary because the virus comes back until such time as we have a vaccine. A year and a half, maybe even 2 years away.
Okay, and that's where we have to leave it. Thanks to all of you for being with us. That's it for this edition of The Heat. I'm Anand Naidu in Washington, D.C. Thanks for watching.
CGTN, covering coronavirus. From Asia, Africa, Europe, and America. The dangers, the uncertainty, a global effort to stop the spread and save lives. For the latest updates on coronavirus, stay with CGTN. See the difference.